Hi, my name is Elizabeth Hart. I'll be doing the head, neck, and eye assessment.
My name is Scott Hart, and I consent to be in this video and recorded.
Okay, so we're going to start off with the head and neck assessment. First, I'm just going to take a general survey of the patient, looking at them as a whole. Right now, I'm noticing that both sides of his face are symmetrical. There's no obvious deformities or anything there. Next, I'm going to tell the patient that I'm going to start assessing their head. By doing so, I'm going to feel the back of their head and the occiput bone, feeling around for any lumps, lesions, anything that would be abnormal. Next, I'm going to move to the front of the face, feeling the temporal region. The temporal artery is here. I'll be able to feel a palpable pulse. Next, I'm going to ask him to assess his temporomandibular joint. By doing so, I'm going to ask the patient to open his mouth. Here, I'll be able to note any tension or trouble doing so. The patient does not have that. Next, I'll be able to move myself down, feeling the neck for any deformities here as well. Here, I'm also assessing for symmetry and range of motion. Next, I'm going to look at the patient's face. There's symmetry on both sides, and moving down onto the throat. There is symmetry on the neck, and I'm going to ask the patient, looking at him with his head erect and still, I notice that the neck is midline. And now we'll assess the neck's range of motion. Could you turn your head to the right? Back to center? To the left? To center? Can you touch your chin to your chest? And then extend your head backwards? Next, I'll ask the patient to touch their right ear to their right shoulder without lifting the shoulder up, and to do so on the left side as well. Here you're assessing for any pain, discomfort, to see if the patient has the full range of motion. This patient does. Next, we'll assess cranial nerve 11. By doing so, I'm going to take both my hands and ask the patient to turn his head to my right. The patient can push with pressure and resist my hand. And to the left. And then I'll also put pressure down on the patient's shoulders and have him resist the pressure as well. Okay. So next we're moving down onto the neck area and we're going to assess the lymph nodes. Here you're just feeling around the neck, feeling for anything that would be enlarged. There's no enlargement in any of the lymph nodes here, which would indicate a normal assessment. The trachea of the patient should be midline. You'll start by going right in between and shifting over to the left and to the right. There should be no tracheal deviation. There is none in this patient. The thyroid gland, there's multiple ways to assess the thyroid gland. First, you're going to ask the patient to extend their neck slightly upward and ask them to swallow. You can see the thyroid gland expand and relax as the patient is swallowing. You can also do so by asking the patient to take a sip of water and observing that as well. Also seeing the thyroid gland expand and relax. Another way of assessing the thyroid gland is coming behind the patient, asking them to extend their head slightly forward, and with one hand, deviating the thyroid and palpating on the other side. This allows you to feel for any enlargement. If there was an enlargement in the thyroid, you would be able to auscultate it with the stethoscope, assessing for a bruit. Now that we've assessed the head and the neck, we're going to move on to the eyes. Asking the patient, does he have any difficulty seeing?
No.
Any blurriness, blind spots?
No.
Do you see any double vision?
Nope.
Have you had a history of any crossed eyes?
No.
Any redness or swelling of the eyes?
No.
Watering or discharge noted?
No.
Any history of eye problems?
No.
Do you use glasses or contacts?
Yes, I'm wearing contacts right now.
Okay. And the last time your prescription was checked?
About a year ago.
Okay. Do you have any pain or watering when you wear your contacts?
No.
Okay. So now we're going to ask the patient to use the Snellen eye chart. This is the chart behind me here. I'm going to ask the patient to get up and stand 10 feet away at a marked line and read the chart for me. From top to bottom, we'll be able to see how the patient's vision is, assessing if it is 20/20. So the patient will begin to read the chart.
CSDVOH OHVCK HZCKO NCKHD DHOSZ VRNDO CZHKS ORZSK.
Okay, so the patient will come back, and the patient does demonstrate 20/20 vision in both the left and the right eyes. He can take a seat. After the Snellen eye chart, we're going to do the confrontation test. This is assessing the patient's peripheral vision. I'm going to ask the patient to look directly at me as I assess their peripheral fields. So while looking at me, I'm just going to come in from the sides, and you tell me when you can see my fingers.
I see it now.
Okay.
I see it now.
Okay.
I see it now.
Okay. Next, we're going to assess the patient's extraocular muscle function. This is the corneal light reflex. You can use a flashlight, a pen light, or any sort of light source to assess this. So I'm going to take my flashlight and I'm going to look at the patient's corneal light reflex by holding the light about 12 inches from the patient's eyes, assessing the light on the patient's cornea. The light reflected on the patient's cornea should be equal in both eyes. Next, I'm going to do the diagnostic positions test. This is assessing the patient's extraocular muscle function as well. Staring at the point of my pen here, I'd like you to follow it with me. Here we're assessing our 6 points, returning back to the center and assessing the other side as well. Okay. Now we're going to assess the extraocular structures. This I also did in the beginning of my assessment when I was looking at the patient as a whole. First, I'm going to note the patient's symmetry of his eyebrows, his eyelids and eyelashes, noting that his eyelashes are equally distributed across his eye. His eyeballs are aligned normally in the sockets. And now we're going to look at his conjunctiva and sclera. Here I'm going to ask the patient to look upwards as I pull down on the lower lids. His conjunctiva are clear and normal color, and his sclera are white. Now we're going to look at the cornea and the lens. So we're going to shine the light from the side just to look at the clarity of the cornea and look at the smoothness. Shining the light from here, I can see that the cornea is clear and has a smooth texture to it, and there's no deviation or abnormality. Next, I'm going to do our normal assessment of perla. So we're looking at the shape of the patient's eyes, if they're equal, reactive to light. I'm going to ask the patient to look directly at me, take the light, come in from the side, assessing that the pupil is indeed reactive to light, brisk, and of normal size. The pupil should be equal in size and equal in reaction as well. Lastly, we're going to assess the patient's accommodation. This is asking the patient to focus on a close object and a distant object. First, the patient will see the object that is close right in front of me. Focusing his vision there, I'm now going to ask him to focus on an object in the distance, somewhere in this direction. Without moving his eyes, he's going to just take a focus and now focus back on the near object. When he's focused on the near object, his pupils are constricting. When focusing back on the distant object, his pupils are dilating. The last part of the eye exam is with the ophthalmoscope. I don't have the ophthalmoscope here, but with the ophthalmoscope, you are assessing the anterior chamber, lenses, vitreous, and internal surface of the retina. When you're using an ophthalmoscope, it's important to remember that you want to use your opposite, the same eye as the patient's eye that you're assessing. so that you're not bumping into each other's noses, and you position the ophthalmoscope in a way where it's almost like an extension of your own eye. So while I use my right eye to assess the patient's right eye, I can have a better look at what's going on here. Overall, the patient has a normal assessment, symmetry of the head and neck, the eyes are symmetrical as well, and no abnormal history or findings in this assessment.